Welcome back to my weekly Sunday 9 p.m. live video. I'm Dr. Tani Ping, consultant obstetrician and gynecologist. And today is our last session of this endometriosis series. So we have total of 8 videos. I can't imagine I already have 8 videos on endometriosis, but this will be the last. So if you have any more last minute questions, please put it in the comment section. Today I will try and answer everybody's question today because this will be the last one, and next week onwards we will start a whole new topic altogether. So next week onwards, because next month is cesarean awareness month, so that's what I'm going to do on childbirth, and I'm going to do on basically anything about childbirth. So it's going to be a series of 4 weeks, and any questions about childbirth I will try and answer at the time. So I will do all 4 weeks on everything regarding childbirth. So all of you who are pregnant or going to be pregnant or had given birth before, and there are some questions that you couldn't understand what was happening, or any of your friends who are pregnant or going to give birth or have given birth before, and there are certain things that happen in their childbirth that they couldn't understand what was happening and they wanted to know more, ask them to stay tuned to my Sunday 9 p.m. live video. Yeah, so for next month, all 4 weeks will be all about childbirth, whether natural birth, cesarean birth, anything will do. Okay, so because if most of you who know me, I am actually very passionate when it comes to prevention of cesarean birth, because I feel that that is something that women can actually work forward to, and that will be the main thing that I would talk about on the first week. But as we go along, any questions anyone want to ask, whether it's regarding natural birth or cesarean section, just post it up in my comment section from next week onwards. Yeah, so this is our 8th video, and for those of you who have missed the previous 7 videos on endometriosis, do look it up at my YouTube channel, Dr. Tan City Clinic, and subscribe. Yeah, subscribe and turn on the notification button. Okay, so today we're going to cover more of endometriosis. Let's look at some of the questions that were posted up last week. So there are some things that I wanted to talk about that I mentioned last week. There are still certain aspects of endometriosis which we have not covered actually. So let's see if it's in the questions that are posted up today. First question is from Lau Jacqueline. Oh, Jacqueline, I can see your name there on my screen. Hi Jacqueline, so this is your questions that you asked last week, and the question is, I want to ask, how do I know if I have endometriosis? I had open surgery done plus lab 6 years to remove few fibroids. All is good until a year ago I started to have period pain. I don't have period pain after the surgery. I have ultrasound check every year, but can't detect anything. I'm in my early 40s and been trying to get pregnant. Okay, something I always tell a lot of women is that fibroid's good friend is endometriosis. Most women have fibroid first, then followed by endometriosis. Why is it? Why? Because fibroids actually distort the whole passage of where the period blood is going to go. So you see, our uterus is supposed to sit nicely in the center. It has 2 tubes at the side, and there's a passage down, right? So when you have fibroid, you do not have this nice passage anymore. The whole shape of the entire uterus, the orientation of the entire uterus, and sometimes depending on where the fibroid is, it can even block the outlet of the menstrual blood and cause more period to be backflow, because we know that endometriosis starts with backflow of the period blood. It starts with backflow of period blood. It starts that way, and then slowly this period blood that is backflowed fail to clear off, and then it will implant somewhere, and then slowly it will grow. So it will grow over time, slowly, step by step. So when I do a lot of fibroid surgeries, especially women who cannot get pregnant, so when we do fibroid surgery, very often we do see endometriosis. Very often we do see endometriosis. In certain cases, we could actually remove the endometriosis together with the fibroid surgery, but sometimes it can be difficult because you can have a fibroid that's so big that is blocking my view to see the endometriosis. Because you must understand, as I mentioned in my videos previously, endometriosis surgery is one of the, I would say, the most complicated surgery in the world. So it is very complicated, and you need very good view looking at the endometriosis before you dare to cut it. Because if you can't see it clearly, don't touch it. Fibroids is different. Fibroid, you don't need to see well. You can just cut it because there's nothing dangerous that could happen if you cut a fibroid or the uterus a bit too much or too little. But to endometriosis, it is quite dangerous if you can't see it well. So sometimes you have very big fibroids in front of you, and then you can't see the endometriosis behind clearly. So you can't do the endometriosis surgery before you remove the fibroid. So then after, when you remove the fibroid, then you will have a situation sometimes where, because fibroid surgery tend to bleed, they don't bleed a lot, but they bleed all those little, like the rain, like drizzling like that, one drop. They like to bleed like that, one drop. So sometimes this one drop of bleeding, again, I cannot see my endometriosis clearly because this blood keep dropping down, because endometriosis is always behind the uterus and is down there behind the uterus, and the fibroid is always up there, and then the blood is dropping down onto the endometriosis, and as a result, I also cannot see the endometriosis well. And so that's why I'm not saying that all cases we don't remove. Ideally, we should remove all of them. But I have to admit, sometimes it can be difficult. And as a result, this little endometriosis that you have previously continue to grow over the years, and now you have period pain. If you tell me you have period pain in your 40s and you never had period pain before, that is definitely endometriosis already. That is definitely endometriosis. You may ask why you may not have the period pain before and you only have it now. You didn't have it after your surgery, but you have it now. There's only a few possibilities. One possibility is the amount of endometriosis at that time is so little. It's so little, and it has not caused pain because it didn't grow in places that cause pain. So that's why you do not have any pain during your period after your surgery. That is one of the reasons. But this endometriosis continue to grow, and therefore now you may actually have pain. So that is one possibility. The other possibility, like I always explain to a lot of endometriosis women, is that we have 3 passages for the period blood to go out. The passage that goes through the tube that goes into the body that causes your endometriosis, that passage is usually very fine. You are born with very fine passage. But once your period starts to backflow, it actually flows through easily already. Over the years, it tries to backflow, and then eventually it will flow through. And once it flows through, it becomes very easy to flow through already. So when you have your fibroid, you may have some distortion of the shape of the uterus or the position of the uterus, and therefore cause a lot of pressure towards the backflow. So over time, it will backflow. And when it backflows, it will forever backflow easily because the passage is now open up and it's easier to flow back. So that is why sometimes maybe you may not have endometriosis at the time of your surgery, but because it can backflow easily now, and as a result of it, it starts to backflow. And that is why now you start to have period pain. So, because you also mentioned that you have difficulty in getting pregnant. So that could be also one of the reasons why you are not getting pregnant, because on top of the fibroid, you also have endometriosis. Okay. If you ask me, is there a way whereby what would you do? It all depends. Honestly, I do not know how much you want to conceive, but now that you have endometriosis, then you really need to think about something, because you either treat the endometriosis, you have to treat the endometriosis. Actually, you have to. It is not an option, because you're in your 40s, early 40s, you have another 10 years. Endometriosis is going to worsen with time. And then in 10 years' time, it can be, or even 5 years, 8 years, it can be very, very bad. If you have seen enough of my videos, listened to enough of stories about endometriosis, you realize that endometriosis can be a very, very bad disease to have if it's very bad. So you have to treat it. It is not an option. So the thing is about people who want to get pregnant and they know they have endometriosis. You know, there are a lot of women who want to get pregnant and they have endometriosis. Some of them, they know they have endometriosis. Some of them, they don't know they have endometriosis. But the thing is, when the endometriosis do not let you pregnant, if the reason for why you're not pregnant is endometriosis, or even you have other reasons why you're not pregnant, but you also have endometriosis, sitting around waiting for your baby to come is never an option, because your endometriosis will worsen with time. And one thing a lot of women don't know, there is a point of no return. If you know enough stories of women with endometriosis, you will know there are women who reach the point of no return. They are being counseled to remove their uterus, to remove their ovaries, to remove everything, because they have already reached a stage where there's no other treatment available for them except to remove everything. And for someone like me, even though I'm more conservative, I don't like to remove people's uterus and ovaries, but I do see cases where they have reached a state where you don't even see a good ovary left. You don't even see a good uterus left. You don't even see a good pair of tubes. Okay, if tubes maybe you can remove, but you can't remove the ovaries or the uterus, then you can't get pregnant at all. So these women, even though I may do conservative surgery for them, but they can never get pregnant anymore, because the endometriosis has attacked both the ovaries or the entire uterus, and there's nothing left. There's virtually nothing left. There's no healthy ovaries or uterus left for them to conceive. That is what I mean by point of no return. So that is the topic which I realized that we have not covered. We have not actually covered fertility with endometriosis. And if you know, last week I attended one whole conference on endometriosis, and of course this topic has been mentioned again and again, because fertility is the main reason. The biggest problem in endometriosis actually is fertility. So when you have endometriosis and you're trying to get pregnant, you have to treat the endometriosis. You have to treat the endometriosis, and there is only 3 options in treatment. Endometriosis, we always say there's 3 possibilities of treatment. Number 1 is to go on medication like Visane. So in order to go on medication like Visane, you need to give up on pregnancy. Because no point, you have already tried so many years. The endometriosis didn't give you a baby already. The endometriosis already refused to give you a baby. You don't just sit around and let the endometriosis continue to progress. There's no point at all. So treat it. Give up. Forget about pregnancy. Treat the endometriosis. Take care of your health, so that your endometriosis do not worsen, so that you do not suffer with repeated surgeries, so that you do not suffer with extreme pain. That is your option number 1. Option number 2 is you have to get pregnant now. Now. You have to get pregnant now. So, if you have been sitting around waiting and trying to get pregnant and you are not pregnant, you must find another way of getting pregnant now. One of the ways, yes, you can do IVF now. Not next year, another year. Not try another 6 months, 9 months. No, it's now. You need to do your IVF now. If your IVF is successful, good. If your IVF fail, then you need to do something else now. Now, there's no waiting. So IVF successful, good. IVF fail, go on Visane now. No more trying. Or third option, surgery. Go for surgery and get pregnant now. Again, the answer is now, because the endometriosis will worsen with time. The endometriosis does not let you pregnant anymore. So you go and do your surgery, clear off all your endometriosis, and try and get pregnant. Okay, once you do a surgery, you have a bit more time to get pregnant. I always tell women 2 years. 2 years max. You have 2 years of getting pregnant. Whether you get pregnant on your own, you want to do how many times of IVF, you all do it within that 2 years. So if you, one way is just keep trying to get not pregnant. If after 2 years not pregnant, please give up. Another way is try and get pregnant on your own. After a couple of months not pregnant, go and do IVF. Don't wait. And you can do many times of IVF, 1 time, 2 times, 3 times, I don't care. But everything is within the 2 years. Within that 2 years, You need to get everything sorted out. You need to get pregnant within that 2 years after surgery. And if you're not pregnant after 2 years after surgery, please learn to give up. Give up. Because if you don't give up, that is the typical case. We see it again and again and again. They do one surgery, they want to get pregnant. They never get pregnant. After 2 years, 3 years, they never get pregnant. They try to do IVF. They didn't succeed. They scan. Endometriosis is back. They still want to get pregnant. So they do another surgery. Second surgery, they do. And again, they try to get pregnant on their own. They don't get pregnant. Then the endometriosis comes back. And then they go and do surgery again. And again. And again. How many times do you want to do surgery? And you must understand, the more you do surgery, the more you're going to damage whatever that is inside. And your chances of getting pregnant actually comes down with the number of surgery. Your chances of getting pregnant comes down with the number of years you wait because of endometriosis destroying all your ovaries and uteruses and tubes. The chance of getting pregnant also goes down with the number of operations you do. So that is never the right choice. Never the right move, which is so typical. I feel so sad. I sometimes tell my patients, I'm so sad when I look at your case. You have done 2 times surgery and you're still not pregnant and you're still trying to get pregnant. I'm sad. Because why? Why did they go through that? Once again, because they do not know what they have to do. Nobody gave them the right advice. The right advice is, again, number 1, get a proper surgery done. So again, very often a lot of women just simply go and find some doctor and get the surgery done. But the surgery did not remove the endometriosis completely. Like today, I just had one case. She had the first surgery done, but endometriosis not removed. The doctor nicely written in her report that endometriosis was burnt, ablated, but not removed. When you do an operation to burn your endometriosis is still there. Okay? So the first surgery is not done properly. So as a result, they still cannot get pregnant. And as a result, the endometriosis comes back so fast. And as a result, they end up not pregnant even with IVF. And as a result, they end up another surgery. It is so typical. So the right thing to do is, if you're going to opt for surgery, you must make sure that the surgery is done by the doctor that is trained for endometriosis surgery. And as I told one of the patients today, it's never the same doctor. The doctor who does the IVF is rarely, I wouldn't say no, rarely the doctor who can clear the endometriosis. Rarely. Very, very few doctors who can do both, are trained to do both endometriosis surgery as well as IVF. I only know one person in this country. I only know one person. And I truly, truly respect this doctor. But there's only this one. The rest, no. You're either trained here or trained there. You're neither trained both. So you have to get it done by the right doctor. Clear it properly so you have 2 years in getting pregnant. And you must get pregnant in 2 years. You have to find ways to get pregnant in 2 years. I don't care how. So normally, if it's my patients, after my endometriosis surgery, because we stop your menses for 6 months, in that 6 months, you have a lot of things to do. I always say, number 1, all other tests for fertility have to be done. Don't come and tell me husband don't want to do sperm test first. No such thing. It's not acceptable at all. I tell the husband straight. You don't do sperm test, how you know your sperm is okay? Maybe after 2 years, you're still not pregnant and the main problem is now your sperm. But then because you never tested your sperm, so your wife endometriosis come back and you're going to subject your wife to another surgery. I say she already had a surgery. What more you want her to do? Do your sperm test. So all tests have to be done. Women are usually no problem. They will do all the tests that I ask them to do. But I have some resistance. Men always like to say, the wife do first. Not all men lah. Sorry. Not all men. Some men. They like to say, you do everything first. No. That 6 months, they have to do a sperm test. Okay, they have to do a sperm test. And every other test, hormone test, sperm test, tube test, everything. And during that 6 months, both the wife and the husband have to go for fertility counseling. Because we do not want fertility stress or fertility mental block to block you from getting pregnant. And also, you have to go for endometriosis complementary therapy, because I don't want my endometriosis to come back so fast. I need you to adjust your lifestyle so that your endometriosis can hold on longer. So that is what I do with all my patients after endometriosis surgery. And then I told them the deadline is 2 years. By hook or by crook, you must get pregnant in 2 years. You have to start planning when you're going to do your IVF. Don't wait until 2 years then say, let's do IVF. No. If you want to go government hospital do IVF, you register now, because there's a waiting list. If you're going to do private, you have to plan when you're going to go private to do IVF. So that is the whole thing about fertility. When you have endometriosis and you cannot get pregnant, your only option of getting pregnant, actually, if you ask me, is either IVF or surgery. We do not know which one will work. Based on research, they are equal. Based on research, they are equal. But when we talk about equal, we are talking about not one attempt in IVF. The research that was presented in the last endometriosis conference is the chances of getting pregnant for people with deep endometriosis, which means it's advanced endometriosis. If you go and do surgery and try and get pregnant on your own, it is about 40 to 50%. If you do IVF, it is also 40 to 50% after 3 cycles of IVF. No, 1 attempt, 3 attempts. You see, the problem in Malaysia is IVF is so expensive. Most of us just do 1 attempt. If you occasionally you see some people do 2, how many of us actually do 3 attempts? Hardly. So that is why the success rate of IVF for endometriosis is not very high. It's still surgery higher, because surgery is one surgery. But we talk about getting pregnant in the next 1 year, 2 years. So you actually give yourself 12 attempts or 24 attempts. So you see, it is not an equal comparison. Of course, if you do IVF 24 times, you will definitely be pregnant. But how many people actually do IVF 24 times? So you see, it's not equal in comparing, but surgery, you ask me, is the way that gives you a better success rate, because you can have 2 years to get pregnant. And it's not like just a 1 attempt, it's like buying a lottery, and you do your IVF, you do buy a lottery and see whether you get it or not. So, but anyway, I'm not against IVF. If you want to do IVF, no harm. There is always a debate about if you have endometriosis, you shouldn't do surgery, because surgery will damage certain things. Yes, true. That's why I say you don't do so many surgery. Every surgery will damage something, but your endometriosis is not letting you pregnant anyway. You don't do surgery, then what are you going to do? You want to do IVF? Go and do. I have nothing against IVF. Go and do. If you're pregnant with IVF, I will congratulate you. But if you're still not pregnant with IVF, what option do you have except surgery? No other option. No other option. So you want to do IVF, you do now. You don't wait another 6 months, 1 year, because you know you already have endometriosis. You shouldn't be sitting around waiting to get pregnant, because the more you wait, the more the disease becomes advanced. There will be a point of no return. So far, I have seen a few, 2-3 cases, not many. When they come and see me, it may be like 3rd surgery, 4th surgery. When I went in, my God, the endometriosis, my God. Because why? These women typically, when it comes to 3rd surgery or 4th surgery, they have been letting the endometriosis grow over the years. So, endometriosis don't grow back so fast if your endometriosis was totally cleared the very first time you did the surgery. But the fact that it grew back so fast means the surgery was not complete in the first place. So the endometriosis has been growing and progressing over the last 5-6 years when you first knew you have endometriosis. So sometimes when we go in, we know it is quite horrible. You can't even see a normal ovary or a normal uterus left. So when this type of women, it is to me a point of no return, because there's no more healthy tissue left in the body. Everything is totally attacked by the endometriosis. So that is what each and every one of you, if you're trying to get pregnant, you must know this. If you have endometriosis, you must know this. Endometriosis is a disease that progresses with time as long as you're not on medication and you're not pregnant. For all endometriosis women, you have only 2 options for the rest of your life until you menopause. You're either on medication or you're pregnant. There's no third option. Don't sit around not taking medication and also not pregnant. Endometriosis progresses with time. And as I mentioned earlier, once the period blood has backflowed, it like to flow back already. It is very easy to flow back already because you have opened up the passage for the period to flow. So that's why endometriosis will keep coming back. I had one patient, I think yesterday, she already had one baby, quite big already, the boy, I think probably in school already now, 7 or 8 years old. And then she just had a surgery 2 years ago, and she's still not pregnant. And then we scanned, there's still so much problem. And then I told her she had actually a surgery for fibroid and not endometriosis. And now we scan as endometriosis. That's why I told you fibroid and endometriosis is actually a good friend. So I told her, you have to first ask yourself whether you still want to get pregnant. Because you already have one boy. If you can say, I will give up pregnancy, then it's a lot easier. I start you on Visane today. After that, I put you on Mirena. Until you're 55 years old, you don't need any more surgery. All well controlled. But if you want to have a baby, then no choice. You either go and do IVF now, or you need a surgery. And in fact, for her IVF, I don't think she'll have a success rate either, because she has adenomyosis that was quite bad. So adenomyosis, when it's quite bad, the IVF rate is not so good. So I told her surgery may be an option. So I said, give up lah. She said, huh? Give up ah? But then when I talked to the husband told her, don't already lah, don't already lah. The husband is more sensible. The husband is placing her health more important than getting another baby. But women are women. No, they are willing to go through everything to have another baby. I totally understand that because I went through a lot just to have my baby. I don't get pregnant easily either. That's why I understand. Women are willing to go through anything and everything just to give birth. You can tell them, I have seen women whom we tell them, if you get pregnant, you will die when you give birth, yeah? They will still get pregnant, okay? That's women. We will go through anything and everything just to conceive and give birth. That's women, what to do. So, but the husbands are always making the more sensible decision. So I asked them, both of you go back and think whether you actually want to have a baby. Are you going to go all out? Or just give up? Take care of your own health. That's it. Okay, Erica asks if endometriosis cysts have been removed, when pregnant, can have natural birth or not? Oh, you can have natural birth. Endometriosis on the ovary, you can have natural birth. Endometriosis on the uterus, which is adenomyosis. If you remove adenomyosis during surgery, some cases cannot have natural birth, need cesarean. It depends on how big your endometriosis, adenomyosis, how big a hole your doctor made in your uterus, and that will decide on whether you can have natural birth or cesarean. But endometriosis on the ovary, you can definitely have natural birth, no worries. Susan Eng asks, may I know what is the risk of ovary stuck behind the uterus, especially when trying to conceive? Can surgery help to remove the ovary back to its original place? Definitely. There are only two reasons why a uterus is stuck to the ovary. The ovary is stuck to the uterus because we say that the ovary and the uterus actually is separated. Ovary is like what do you call that? Like a fruit dangling from a stalk, You can actually move it around, It's like a round thing that you can move around, dangling. But when you have endometriosis, you can have adhesion whereby the ovary and the uterus stick on each other because there's endometriosis in between. I always like to describe endometriosis is like a glue, It's like a glue. So when you have endometriosis here and you have ovary here and your uterus here, they will stick next to each other because they are actually next to each other. They will just stick on each other, and then when you stick on each other, it's stuck. So when it's stuck, most of the time it's due to endometriosis. Occasionally, it's due to previous infection to your ovaries and tubes, and then you can also get the ovary stuck. There's only two reasons. So most of the time, it is still endometriosis, but it doesn't matter which reason. It's difficult to get pregnant because in order to get pregnant, your uterus and your tubes and your ovary must be in its original position. We always say there's two aim whenever we do a pelvic reproductive surgery. That means we want to do surgery for women who are going to get pregnant. There are two things we must do. One is we clear off everything. So we clear all the endometriosis, we clear all the fibroid, we clear everything. But there's another one more thing that you need to do is to return everything back to where it's supposed to be. Ovaries are meant to be a certain position, the tube is meant to be in certain position, and everything is supposed to be free moving. That is our aim when we do surgery. We cannot just remove the cyst and that's it and finish with it and the rest all leave it. No use. You're not going to get pregnant. So you have to make sure that everything goes back to where it is. As I always say, we want your uterus, your ovary and tube to go back to what it was when you were 16. You may be 36, but we want to make you 16 again. So that's what we're supposed to do in surgery. Yes, surgery is the only way. Your question is, can surgery solve this problem? Surgery is the only way to be able to separate the ovary and the uterus and return back the ovary back to its normal position. Okay? Alright. Let's see what the question you have today. So mainly today, the main thing I want to talk about is fertility, because that is one very important topic in endometriosis, and I was surprised not many people asked all this while. But fertility is actually the biggest problem. The biggest headache for endometriosis is fertility. That's why for all of you out there who are young, whom you think you have endometriosis, please take care, because we do not want fertility to be your biggest headache in the future. Amy asked this question. Hi doctor, I'm on Visane medication treatment now, trying to find out, would this cause negative effects to my fibroid, which is 2 to 3 cm? What is your advice for us to control these two diseases at the same time? Okay. Alright. So this is a bit tricky. There are two things I want to know. First, there's one main thing I need to ask first is like, are you really sure it's fibroid? Okay, why? Because there is a difference between fibroid and adenomyosis, and trust me, a lot of people like to diagnose it wrongly. They scan and say this is fibroid, and then actually it's adenomyosis. And then they scan, they say it's adenomyosis, and turn out it's fibroid. I believe every single one, every single doctor, every single sonographer in this world have made that mistake before, because it is not a mistake, because it's sometimes very difficult to differentiate. So you actually have lectures and lectures trying to teach people how to differentiate. I even have in the last conference how to differentiate a fibroid from an adenomyosis, all the things to look for. So it is actually not that easy to differentiate, and it is a topic that keeps coming up in all courses and ultrasound courses, workshops, conferences, because it's so often that people mistake it. So the first question is, I want to know whether it's really fibroid. Because if it's really fibroid, then Visane will make the fibroid grow. That's why when patients come to me with both fibroid and endometriosis, I will tell them that if I give you a medication that treats your endometriosis is easy, there's always medication. You have progesterone, there's so many types of progesterone in this world. There's so many types of progesterone. You have at least 5-6 options for you to choose from. And all progesterone can control endometriosis, can treat endometriosis, can prevent endometriosis. But there's a problem. Fibroids can make, and progesterone can stimulate the growth of fibroid. Not 100%, 50%. Why? Because not all fibroids are have progesterone receptors. That's what we call that. Some, in simple words, is that some fibroids feed on estrogen, some fibroids feed on progesterone. So if your fibroid feed on progesterone, and now I give you Visane, which means I'm feeding you progesterone, and you are actually feeding the fibroid progesterone. So when you take progesterone for endometriosis, your fibroid can actually grow. So at the end, you have to weigh the balance. Is there anything that can treat both together? Yes, there's only one thing that can treat both fibroid and endometriosis. Guess what? Surgery. Surgery is the only way to treat both fibroid and endometriosis. So at the end, what I mean by you need to weigh the balance, we have to look at what do you call that? First, we want to see which is more important. And we have to look at your age. Like recently, I have this lady. She's already like 43, 44. And then she has endometriosis, and she has this small little fibroid. So between the fibroid and the endometriosis, what do I worry more? I worry about endometriosis more because she's symptomatic, And we know that endometriosis, sometimes we may not be able to know the extent of the disease so clearly by an ultrasound scan. So she can be having endometriosis on her kidneys and ureters and bladders and lung and everywhere. We don't know. And at the same time, when endometriosis, the risk of cancer is definitely many times higher than the risk of cancer in fibroid. Fibroid, number one, it doesn't cause pain or anything. Number two, fibroid you can see on ultrasound scan, so I can monitor. I can monitor my fibroid. I know how big it is, how many it has grown. You got new fibroid, old fibroid. All I can see so clearly on ultrasound scan, so I can monitor it well. Endometriosis, I cannot monitor it well. Fibroid doesn't cause pain or suffering. Endometriosis cause pain and suffering. And another thing is fibroid's chances of becoming cancer is very low. But endometriosis chances of turning cancer is so much higher. So between these two diseases, endometriosis is my priority. So if I look at your age, I know your fibroid is going to grow. But I also know that fibroids die when you menopause. So if you're in your 40s, maybe I will just think about your endometriosis and I just treat your endometriosis, that's it. I let the fibroid grow, I just monitor. As long as the fibroid is not too big, I'm fine. You will menopause eventually. But if you're young, that is another story. If you're young, that is another story altogether. Because if I'm going to put you on endometriosis medication for the next 20 years, your fibroid is going to grow as big as, I don't know, watermelon size. It will be so big. I've seen fibroids this big, okay. So, no. If I to give you Visane when you're very young and you have fibroid, you eventually need another surgery. Because your fibroid is going to grow so big up to an extent that you have to operate. Because our cutoff for fibroid to operate is 8 centimeter, and if you're so young, you will definitely reach 8 centimeter. So if I give you Visane and I see your fibroid from 2 centimeter growing to 3 and 4 and 5, I will do a surgery, and let's do a surgery, solve all problem. One surgery, go in, remove fibroid, remove endo, everything solved. So that will be what I will do if you have both. That's why most of the women, when they have both, I told them you don't really have a choice. Surgery is your only option. And when to do the surgery, you do now. You do now. You don't do 2 years, 3 years later. Because you are not going to take your Visane because you worry about your fibroid growing. Unless you take Visane and just monitor your fibroid and do your surgery 2 years later, I think it's fine. But if you don't take Visane because you're scared your fibroid will grow, and then you just want to wait and see, and sit down and wait, well, that is not a good option. Because endometriosis is going to progress and you can't even see it. You can't even see it. You need to do your surgery now. So this is what I would say for Amy's case. Teo Hui Min has a question. Is there a possibility that the medication used in IVF procedure elevate the endometriosis symptoms, especially for those who have just had surgery to clear off endo? That is a good question, and the answer is yes. It's not symptom, but because when you go for IVF, you take a lot of injections. And all these injections actually stimulate endometriosis to grow. Okay, let's say if you have done a surgery and you know your doctor told you I've cleared 100%. Okay, I've cleared 100%. Then I'm not worried about IVF medication. Or even if your doctor tell you maybe still got 5% left lah, but 95% clear already. Left that little bit, I'm also not too worried about the IVF medication, because even though it will stimulate, it's just 1 month ma, it's not 10 months ma, it's just 1 month ma. How much can it stimulate? Little bit more only, little bit more. Then after that, if you're pregnant, fine. If you're not pregnant, I hope you know you have only 2 years. Please make sure you're pregnant within 2 years. If not, just please give up. If let's say you have a surgery done and you know that most of the endometriosis is still left behind, then of course this IVF treatment will just aggravate everything and your symptoms will come back. That's why you actually see a lot of women who tell you that I don't have any more period pain after the surgery, but after my IVF, my period pain came back. Actually, if you tell me that, I know one thing, your IVF surgery not clear. Still a lot left behind. Maybe 50%, 60% still there. That's why when you IVF surgery, IVF injection for that 1 month IVF injection, already enough for you to be pain, to get back your menstrual pain. So bottom line is still, did you have a clear surgery done? That's very important. Okay, and for people who have IVF, who have endometriosis, just now I told you, right, if you have endometriosis, you either do IVF or you do a surgery. So that's why when you do IVF and you're not pregnant, you better fast go and do your surgery, because IVF worsens the endometriosis quite fast. So it worsens it, makes it worsen faster than what it would be without the IVF. So that is why if you have done your IVF and you're still not pregnant, then you just faster go and do your surgery. No delays here. Alright, next will be Angel. Angel has a question asked. I've just done my surgery 9 months ago, and after the 6 months of Lucrin, he told me that not fully clean. So I need to go for another round of surgery. Angel, you have two options. You either go for another round of surgery, or you go on medication. So actually, I do not know about Angel whether or not you are trying to get pregnant. First, if you're not going to try pregnant, it's very simple. Same as what I've always said. Everyone who after surgery, you get your Lucrin, you need to be on maintenance therapy. You need your maintenance therapy. You cannot be sitting around letting your endometriosis progress here. So please go on maintenance therapy. So please go on maintenance therapy if you're not planning to get pregnant. And then you have to go for dietary changes, pelvic floor therapy, as well as stress management. I like to group all this as complementary, endometriosis complementary therapy. So you need to go on maintenance therapy, which is progesterone based, and you need to be on complementary endometriosis therapy. That is lifestyle changes to delay the onset of endometriosis if you're not trying to get pregnant. If you're trying to get pregnant, then you better go and do your IVF now, because you know your endometriosis is still left behind. Don't wait anymore. Go and do your IVF, and maybe I'll give you another 6 months, 1 year. If you're still not pregnant, yes, surgery again. So also depends on whether you have pain or not. You have no pain, but that's very sad. Honestly, I feel very sad when people come again for the second surgery, because they have a tendency now with all my social media thing, they always come to me for second, third, fourth, fifth surgery. So if you're trying to get pregnant, go and do your IVF, because you know your endometriosis, they already reduce most of it. If you don't do now, eventually everything's going to come back and then you need another surgery. Because you want to get pregnant, you cannot be on medication. So go and do your IVF. Give yourself maximum 1 year of trying to get pregnant, including your IVF and natural, all 1 year. Not pregnant, then you have to ask yourself, must you get pregnant? If must, sad to say you need another surgery. Okay, if not a must, then it's okay, you don't need another surgery. You just go on medication, you just take Visane, put Mirena, go on progesterone therapy for the rest of your life. So it's so simple. Actually, endometriosis is so simple. You know, I'm quite sure for all of you who have listened to all 8 videos, you already know what to do with endometriosis. It's so simple, but the decision is so difficult. It is so straightforward, but the decision is difficult. So please take care. Please take care, everyone. Please know when you should stop trying to get pregnant. Please know about complementary therapy. Please know about maintenance therapy. Please know about what it means by complete endometriosis surgery. Please always only go for complete endometriosis surgery. Don't go for surgery that is not complete. Alright, so that is why I do all 8 videos here. I do 8 videos because I want to create awareness. I hope you all will share it wide. You have to create awareness, because if you don't create awareness, again, women are going to get surgery done by and not complete. And it comes to us for complete surgery. Actually, I don't like that. I rather you come to me as a first time surgery, and I do a complete surgery for you. Because then I can also educate you properly, send you for maintenance therapy, and also go for complementary therapy, and then you don't need any more surgery for the rest of your life. But if you come to me at second surgery, number one, it is more difficult to do a second or third surgery. The more number of surgeries you have, the more difficult it is for me to do the surgery on you. So the risk is higher, the more damage to you. It's not good in every sense. But no choice, no choice. And it's not just Malaysia. You must be thinking why a lot of Malaysia doctors don't do complex. No, it's not Malaysia. I just had an endometriosis conference last week that have doctors from all over the world, and this conference is organized by US mainly. Is from the Endometriosis Foundation of America. And trust me, it's the same thing even in America. There are certain doctors those who can do endometriosis surgery, they tend to get those people who come as second, third, fourth surgery. So it is the same problem all over the world. So it's not really, what do you say, that it's not really the doctor's fault. No, it's not the doctor's fault. It's just that endometriosis surgery is very complicated. It needs years of training to reach there. And each and every doctor have different interests and different interests to reach a certain target. Like, I want to be the best IVF doctor. I also need many years to train myself to be the best IVF doctor. So if I want to be the best IVF doctor, then I cannot be the best endometriosis surgeon. Can't. Unless I continue to learn. That's why I say in Malaysia there's only one doctor who is doing that. But he's very old. He was already the best IVF doctor you could think of. Then only he started learning how to do endometriosis surgery. So it took him many years to be the best IVF doctor, and then it took many more years to be the best endometriosis surgeon. That's why I truly respect him, because despite his age, he still went on. I don't know, maybe I will retire by then. Okay, Jacqueline has something else to say. So Jacqueline was the person who mentioned that she has fibroid and then now she has menstrual pain. If really need to do surgery, what surgery type and what is the healing period? So after heal, then proceed to IVF. As I told you, if we're talking about surgery for endometriosis, if you look back at my videos on surgery on endometriosis, Jacqueline, there is only that one type of surgery to do. So we always recommend, if possible, to do robotic surgery. If not, then at least do a laparoscopy surgery. Never an open laparotomy, never. That one endometriosis cannot clear one. That one is guaranteed cannot clear one, okay? So always do either a laparoscopy, if possible, a robotic surgery. Go through my video, I think it's series number 3, where I talk about surgery in endometriosis. So if it's laparoscopy or robotic, the healing process is very fast. Do you need to proceed with IVF immediately? Not necessary. After surgery, we will know how bad your endometriosis. We will roughly be able to tell what are your chances of getting pregnant on your own. Many people with IVF surgery, many patients, when I do surgery, I already more or less know whether they can get pregnant on their own or not. Normally, I will be able to tell them, okay? Because it depends on how much damage endometriosis has done to your ovary, your tube, and your uterus. And by looking at that, we more or less know what are the chances of you getting pregnant on your own. Or even what are the chances. As I said, there are some with point of no return. They don't get pregnant at all, whether IVF or on their own. Paul Jie has 2 questions here. Would you recommend remove adenomyosis prior to IVF? How severe of adenomyosis consider high risk of pregnancy? Okay. Adenomyosis, it all depends on what is the percentage of your uterus that is affected by adenomyosis. If you're talking about like 20-30% of your uterus got adenomyosis, that one I strongly support surgery. Why? Is because I have so many. I have countless. Actually, I don't even know how many, but there are really a lot of women with endometriosis, adenomyosis, and it's not too bad, and which have this surgery and they got pregnant. And most of them got pregnant on their own, and many of them, actually a lot of women with adenomyosis, they don't actually have much endometriosis, and these are the very lucky women. When you take out the adenomyosis, they just got pregnant instantly, it's like, ting, they're pregnant already. So, but some women, they have both. Then, of course, that one will be a bit tricky depending on their ovary and how bad is their ovary, or how good is their ovary. Okay, so, but if let's say your adenomyosis is 100% of your uterus, 100% of your uterus actually can almost tell you it's almost near impossible to get pregnant, whether naturally or with IVF, because you need a healthy uterus to get pregnant. Adenomyosis makes it difficult to get pregnant. So it depends on what your percentage of adenomyosis in your uterus. If you only have 5% of your uterus has adenomyosis, you can get pregnant one, no problem one. But if like 30-40% of your uterus got adenomyosis, that's when it becomes difficult. So that's why we need to do surgery. Because in adenomyosis, even with IVF, the success rate may not be so high lah. But if you have 100%, then it's difficult lah. So you ask me how severe the adenomyosis consider high risk for pregnancy. That is actually, it all depends again on how many percentage was removed lor. Because when we do adenomyosis surgery, we don't actually remove the adenomyosis, because adenomyosis cannot be separated from the uterus. Adenomyosis is a disease of the muscle of the uterus. So it's the disease of the muscle of the uterus. So when we remove the muscle of the uterus. So if you only remove like 20-30% of your muscle of your uterus, a lot of time it's not really big problem. That's why I said I got so many women who I have already operated on them and they got pregnant with adenomyosis and they gave birth, and some of them give birth more than once, and it's not really a problem. So it all depends on how much of the uterus that is removed. So sometimes when we do adenomyosis surgery, we also never aim 100% remove one. Let's say 30% or 40% of your uterus has adenomyosis, but I may only remove 20 or 30%. I leave a bit more behind. It's fine, because we know a small percentage of adenomyosis can still get pregnant one. So we have to balance lor. When we do surgery, we have to balance. We have to balance on, because your purpose of doing surgery is to get pregnant. So I cannot be so ambitious as in I want to clear your adenomyosis 100% and then after you cannot get pregnant. Too dangerous. Cannot, right? It's not fair to you. No, we are also a bit conservative when it comes to that. So that you can still get pregnant and still can give birth safely and still can. So that is the thing we have to decide during surgery. But I have seen people with 100% adenomyosis, but there's really no option what she can do anyway. So she asked for surgery, I still do. But of course I cannot remove 100% of her uterus, right? Then there's no more uterus. But our purpose is to reduce her disease bulk. But I don't think she got pregnant even with IVF. So you see, that's why I say don't go until a point of no return. When you have endometriosis and you want to get pregnant, you need to make sure you do everything now. Don't wait until a point of no return. We feel sad because we want to help you. But you come to us already, point of no return, how? Second question is how doctor decide whether to give Visane or not before Mirena treatment or disease severity lah. Visane is faster, Mirena is slower, that's all. So if you think the disease is not so bad and you can take time to heal, take time to treat, then Mirena lor. If you think the disease is very bad and you want to get it well fast, then Visane lor. But Visane is short term, Mirena is long term. So ultimately everyone for me is Mirena, because Mirena is long term. Shafira asks, a lot of people ask me to recommend. I won't know other people, honestly. I won't know. Because you must understand that there is no registry to say that this particular doctor is trained in doing endometriosis. There's none. And all this is our own effort to go and learn. All of us go overseas to learn because it's not available locally. So at the end of the day, you have to ask your doctor. I always say the questions that you can ask. Doctor, if you do my surgery, if I later when you go in and then you found that the bowel and the uterus is stuck and there's endometriosis at my bowel, what will you do? So there's only two answers. One answer is the doctor say, I will separate your bowel from your uterus and I will identify where is the endometriosis and I will remove it. But another doctor will say, if I see that, it is very risky. I'm not going to do anything. I'll just remove your cyst or whatever I can remove. The bowel I'm not going to touch. And then after that, I'm just going to give you Lucrine. So you see, two answers. You ask me, 10-20 years ago, I was that doctor as well, before I was trained. So there's still a lot of doctors who are not trained. So they will say that. And that's not wrong, because in his hand, he's not trained. He cannot touch the bowel, yeah? It's so dangerous if he touch it because he's not trained. But is it that dangerous to touch bowel? You ask the colorectal surgeon. He cuts the bowel every day. It's not dangerous at all to him because he's trained. He knows how to cut the bowel properly. You ask the colorectal surgeon, he's very scared of our uterus and ovary one because he's not trained. So ultimately, you have to ask the doctor. I can't help you. You have to ask. If you know you cannot get the right doctor, you are only in Kuching, you know. You can always fly to KL. Yeah, that is also a problem because Kuching have to quarantine. But it is not really a problem if you fly to KL. Why? It's because under medical tourism, you can be quarantined. No, you fly to KL, you don't need quarantine. So when you fly back, you need quarantine. Don't know. I can't solve your problem. That's government's problem. But not so big deal lah. Quarantine. Yeah. I'm hoping to be quarantined, but still no chance to be quarantined. Okay, why I'm hoping to be quarantined? It's because I still have one more book to write. You know, at the beginning of the pandemic, I told myself, if I'm going to be asked to quarantine because of the pandemic, then I'm going to write my book. But unfortunately, until today, I'm not asked to quarantine yet, so I have still not written my book yet. I have a book that I'm supposed to write, okay? So all of you already know, I mean, most of you may know, I already have one book. If you go to my website, which is City Woman and Child Specialist Clinic, you will see that I already have one book on sale there. So I want to write another few more books. Endometriosis is one book that I will eventually write as well. But I still have other books to write too. Yeah. Alright, so because I feel that there are a lot of things that I know, that I do, and I want to share it. Sharing other than live video, book is another option. So that is why I write book. Okay? Okay. Alright, so time's up as usual. 10 o'clock, 1 hour. Okay, that's my video. It's always 1 hour. So this is the very, very last video for this endometriosis series. I'm not sure whether I'll do it again. I'll probably do it again because there's always an endometriosis awareness month every year, which is March every year. So definitely I will do some more endometriosis in the future, but I'm going to take a break for a while from endometriosis. We're going to cover other topics. So for those of you who are still new, who have not seen the rest of my videos, please go to my YouTube channel, Dr. Tan City Clinic. Subscribe to my YouTube channel, turn on the notification button, and go through all the other videos that you have missed, okay? Yes, then for next month, because next month is Caesar Awareness Month, so I'm going to change to a different topic altogether. Now we're going to talk about pregnancy and birth. So I'm mainly going to cover about birth, everything about birth. Natural birth, cesarean birth, everything. Okay, for all of you who have been following all 8 weeks on my endometriosis live video, thank you very much. Thank you very much for your support. To all of you who have wished thank you on my Facebook, and I wish to do this more. Okay, please spread this to more people so that everybody gets to do the proper surgery right from the start, so that women do not need to endure multiple surgeries, do not need to endure prolonged suffering, and do not need to endure the final ultimatum of removing the uterus and tube. That is the main thing we see, that we feel very sad because these women had no knowledge of what they are going through, didn't know what they should do. So as a result, they are the ones who suffer at the end. So please, yeah, so many women suffer out there. We know that endometriosis affect about 20% of women. 20% of women is a lot, yeah. And these 20% of women are the women that we talk about that actually diagnose endometriosis. There are still so many out there that are not diagnosed. So I believe the number is not just 20%, it's more than that. So there are really a lot of women out there with endometriosis. Please spread this news far and wide. Okay? Please share my video to everyone. Please share every one of my video to everyone. So let's spread this knowledge for this month of March, which is Endometriosis Awareness Month. So next week, I'll see you again, same day, same time. Thank you and bye-bye.